Good morning, everyone, and thank you for joining us. My name is Kendra Loney, and I'm the Public Information Officer for the Office of Emergency Management and the Nashville Fire Department. I'm filling in for Chris Song, who is at the historic Metro Courthouse this morning for the State of Metro address. We will begin today's COVID-19 press briefing with Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. He will be followed by Director Chief William Swan of the Office of Emergency Management and the Nashville Fire Department. We also are joined this morning by Diane Lantz, Director of the Metro Office of Family Safety, and Sharon Roberson, President and CEO of the Ywca Nashville and Middle Tennessee. Dr. Michael Codwell, Metro's Public Health Director, is here with us to help answer your questions. Mayor John Cooper will not be joining us today as he is preparing to deliver the State of Metro address at 10:30. We will now begin with Dr. Alex Jahangir.
Thank you, and good morning, Nashville. Here's the latest information on the COVID-19 epidemic. We now have a total of 541 confirmed cases with 3 fatalities. This is an increase of 98 cases in the past 24 hours. Now, while this may represent the biggest daily increase in cases I have reported so far, our epidemiologists tell me that this is partially due to a statewide backlog of cases being reported to local entities. So, of the 98 cases, some of the cases that should have been reported over the past several days are now being reported today. So thus, our real daily incidence of cases may actually be a bit less than 98. The patients range in age from 2 months to 84 years old. Of the confirmed cases, 14 are currently hospitalized. 444 cases are self-isolating at home and have mild and manageable symptoms. 80 people have recovered and have been cleared. Yesterday, Governor Lee issued a safer at home order for the state of Tennessee until April 14th. The science and public health best practices have shown that this is to be an effective tactic to win this battle against this virus, and I appreciate the governor for taking this step. Yesterday, we launched our community assessment system for Nashvillians who are concerned that they may have COVID-19. If you think you have symptoms, the first step is to call our hotline at 615-862-7777. The hotline is open 7 days a week from 7 a.m. to 7 p.m. Based on that call, we will determine if you need an additional screening. And if you do, our operators who are healthcare providers will refer you to either your own personal healthcare provider or to one of our community assessment centers. 2 centers opened yesterday and a 3rd will open on tomorrow. These centers will have additional screenings, and if indicated, you will receive a COVID-19 test. The community assessment system expands our ability to assess more of our residents, as well as conduct even more tests. Director Chief Swan will give us an update on how the first day of these assessment centers went. But we still need your help when it comes to supplies. If you have supplies and you are not currently using them, please donate them. We need them for our assessment centers as well as our first responders. Please feel free to visit our website, covid19.nashville.gov. Or if you have smaller donations, please bring them to the Community Resource Center at Omohundro Place, and this is open Monday through Saturday from 10 to 4. I really do appreciate everyone who's contributed, and I personally want to thank individuals such as Adam Capps, of Nashville. Mr. Capps personally raised funds, which he then used to, through his resources to find 500 face masks, which he donated to us yesterday, and we are now using them for first responders as of today. So I'm really grateful and ask you to please continue that. In Nashville, we are also in our 2nd week of our Safer at Home order. Thank you to all of you who have stayed home. But for those of you who need to go out, please remember to stay socially distant. We really need you to focus right now and stay at home if you can. Before you go out, please really do ask yourself, do you really need to go out right now? Is this trip necessary? And again, if the answer is no, then don't go out. If the trip is necessary, please practice social distancing. This means staying 6 feet from others, spacing yourself out, and if you're in a checkout line, please make sure you have a lot of distance in front of you from the next customer. If you're in a shopping at a grocery store, wash your hands, use sanitizer when you touch the door handles, whenever you touch shopping carts, and only touch items which you really are intending to purchase. If you follow these instructions, you really are helping us fight the virus. If you help us fight the virus, you're going to help our healthcare workers, you're going to help your senior citizens, you're going to help everyone in your community. So this is very important, and that's why I keep re-emphasizing this. So please, please, please follow these instructions. You know, as we go on every day, it becomes more evident to me that we really are all in this together. And I know we're all working together to get over this. So again, I'm very grateful from the bottom of my heart. And I now turn over to Director Chief William Swan. Thank you.
Thank you, Dr. Jehangir. So a real quick update on our assessment centers. We had a successful launch of the assessment centers yesterday. Nearly 500 people called the COVID-19 hotline. 217 persons were screened at the assessment centers, and 143 persons were tested. The screening and the testing took approximately 4 minutes per car. I want to credit everyone that played a part, from the planning team to the volunteers to the medical professionals who are executing the plan. So thank you to all of our partners, including Nashville General, Vanderbilt, Meharry, St. Thomas, HCA, the Davidson County Sheriff's Office, Metro Nashville Police Department, Nashville Fire Department, Hands On Nashville volunteers. These partners have shown us that when everyone comes together for a common goal, we are greater together. A third site is due to open Wednesday, April the 1st. It will be at the former Kmart site, Murfreesboro Pike, 2490. Sites will open Monday, Wednesday, and Friday. The operating hours will be 9 a.m. to 3 p.m. So again, we thank everybody for participating with the Safe at Home and also using the hotlines to make sure that you call before you come to assessment centers. So now it's my honor to introduce the Director of Office of Family Safety, Diane Lantz. Thank you.
Thank you, Chief Swan. It's been a lot of great information about social distancing and staying at home, which are important guidelines for all of us to stay healthy right now. Unfortunately, for some in our community, not everyone is, in fact, safe or in their home, and it is to those people that I am speaking to right now. In particular, victims of domestic violence, child abuse, and elder abuse who are not safe in their home because an abuser lives in their home. This is an unfortunate reality for many people in our community who live with an abusive spouse, intimate partner, relative, or caregiver. And in times of heightened stress, uncertainty, and financial strain, that abuse can be more severe, and it can even become deadly. As victims of domestic violence and their children become increasingly isolated due to COVID-19 precautions, it creates increased opportunities for abusers to dominate every aspect of that victim's life, including phone, computer, access to helpful services, interactions with family, interactions with friends, relatives, and caregivers and neighbors. Not only is this level of confinement with the abuser making it harder, much harder, for victims to get the help that they need, it is also making it easier for abusers to abuse, which is deeply concerning to us all. Without the presence of other people in these individuals' lives, again, such as family members, friends, neighbors, and especially in the case of children, without the presence of teachers in their lives, there's no one there to notice a serious problem and that someone's life might be at risk. This is further complicated when a victim has added vulnerability such as being a child, being elderly, or having a disability. This is why Metro Government's Office of Family Safety is remaining open throughout this crisis. There are amazing advocates at work every day to assist victims of domestic violence, elder abuse, child abuse, and human trafficking. Some of the assistance provided at Nashville's Family Safety Center, which is at 610 Murfreesboro Pike and is open 24/7. You can come there and you can get an order of protection if you need one. We have advocates that will help you plan around your safety, especially with COVID-19 precautions. That can be especially tricky, and having an expert help you is very important. You can have advocates assess your level of risk of being seriously injured or killed by your offender and connect you to needed and essential services for your safety. Working alongside Metro's Office of Family Safety and within the Family Safety Center and around the Family Safety Center are many hardworking, long-standing nonprofit partners that also remain open and hard at work for victims in need. A few critical nonprofit partners include Nashville's 3 shelter providers, Agape, the Mary Parish Center, and Nashville's largest shelter provider, the YWCA's Ywca Domestic Violence Shelter. All remain open. All have COVID-19 protocols in place to keep clients and staff safe. For those that cannot get to the Family Safety Center at 610 Murfreesboro Pike or other helpful service providers in the community, you can call or text the YWCA's Crisis and Support Helpline. To call, you would call 880-334-4628, or you can text 615-983-5170. For those out there listening who might have a family member, friend, or coworker who is a domestic violence victim, please stay connected with that individual to the best of your ability. Maybe have regularly scheduled contact times with them each day so you know that they are safe and okay and that you are there and you care. And make sure they know that Metro's Office of Family Safety, the Family Safety Center at 610 Murfreesboro Pike, and Nashville's shelters are all still open and are all still able to help. And for those who are struggling with violence in their home, please know that you are not alone. I would like to introduce Sharon Roberson, who will be speaking next. She is the President and CEO of the YWCA of Nashville and Middle Tennessee.
Thank you so much, Diane, and I'm very appreciative of this opportunity. The YWCA's mission is to keep victims of domestic violence safe. And as Diane has stated, these are very difficult times when we are often confined to our homes because of the safer at home orders. During these difficult times, we have what we view as an additional health crisis, and that is the crisis of domestic violence. And this is added to the COVID-19 crisis. As a result, the YWCA has to remain open. We stand ready to serve all victims of domestic violence. We have seen an increase in our calls, unfortunately. We have seen an increase in our texts and demand for our services. We are doing everything possible to make sure that during these times of crisis, that these victims are not forgotten. As Diane stated, the Ywca Domestic Violence Center remains open and will remain open during this time. We stand ready every day and now more than ever to help victims of domestic violence. We find it unacceptable for anyone to have to choose to stay in a violent, unsafe environment because they are sick or may become sick. We have put in place protocols to keep both our clients and our staff safe. These protocols include social distancing, taking temperatures, and use of face masks and gloves when appropriate. Also, we are leveraging the community resources that have already been discussed today, including when individuals show signs of illness. We take appropriate telemedicine avenues to make sure that when we send people for testing, should we have to, that we're only doing that so that we do not strain the limited resources that may exist in our community. In addition to the Ywca Domestic Violence Center or shelter remaining open, as Diane stated, we do have both a phone line and a text line. And I must stress that these are not only for the victims, but also for friends, families, and individuals that just want information on how to help. And I'm going to correct the phone number. It's 1-800-334-4628. 1-800-334-4628. And we also have texting capacity because often this is easier to do than making a phone call. That number is 615-983-5170. 615-983-5170. If you just want information about resources that exist in this community for domestic violence victims, you can also go to our website, www.ywcanashville.com, C-O-M. www.ywcanashville.com. And to all of those who are struggling, all those women, children, and families, and men in a violent or volatile situation, please reach out. We're here. This is part of our mission. And no matter how hard the times may seem, we're here for you. So make sure that you take care of those in your families and take care of yourself. Thank you very much.
We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We will start with Jeremy Finley.
Good morning. Thanks for answering our questions. I have a two-part question. First one being, if you could explain the backlog again that you're experiencing that altered the test numbers. I just wanted to get a better understanding of how those numbers are now impacted because of this backlog. And secondly, we're hearing a lot of complaints from people about how long it's taking to get the test results. How quickly is the city going to be able to give people their test results from the testing you're now doing? Thanks.
Thank you. Remind me of the first part of your question. I have an answer for your second part. Remind me of the first part of your question, and I apologize.
Sure. First part is, could you explain, Doctor, again, explain more about the backlog?
Oh, yeah.
How it's impacted today's numbers? Thank you.
Thank you. So what the numbers we report every morning are numbers that our epidemiologists, who, by the way, if I can sidetrack for a second, we have an amazing group of epidemiologists at the Public Health Department, Leslie Waller and Josh Lever, just to name two, and I have to say Brett Kellman a few weeks ago in Tennessee wrote a great profile of them, so I have to give that. I encourage everyone to read about this. But the reason I bring that up is when the state reports a case, and the way the reporting happens is the state is notified of a positive test, and they notify the local entities. Our epidemiologists literally go to task right away, calling the individuals, putting the data in, and tracking. So literally they find out like who has been in contact with these people. From what they described to me, because every evening I get these numbers, I review them myself, I call, and we have a dialogue with our epidemiologists. And what they explained to me is that there was some kind of backlog from the labs to the state. So not necessarily state labs, private labs and others. And then thus when the state processed them, they quickly got them to us. And so that's the best explanation I can provide you from a city standpoint. I can tell you the moment that the Public Health Department of the city has the information, we relay them on to you. But our epidemiologists are working much harder now because there's almost 100 new cases that they have to track. That's number one. Number two is the backlog. I'm sorry, the how long it takes for test results to come back. Our tests that we're doing at our assessment centers, as well as what every other facility is doing, are all different labs. We're using a private lab that the state has arranged for us. That is purely a function of how quickly those labs can process the tests, how quickly they can run tests at one time, how many reagents they have. I can't give you a definitive answer on that because it really is up to each individual lab. But obviously, the more they are tasked to do, there probably will be a longer delay. We've been given a time frame of 5 to 7 days for the tests that we are sending to the private lab we're using for the city's assessment centers or the community assessment centers. Each organization has a different backlog. So I hope that answers your questions. Thank you so much.
We'll have our next question from Tosin Fakali.
Good morning. Yeah, this is Tosin with News 4. I had a couple questions. The first is, have people started seeing some of the money from the response fund? Has that distribution started for people? And I know we've had a couple shootings in the last couple of days, so I'm wondering if the police force has seen, are they seeing more or less crimes, responding to more or less crimes with safer at home in place?
We'll have Director Chief Swan answer that question.
Thank you for that question. And I will get with Chief Anderson to get a more definitive answer as far as what the crime rate is. So I will not be able to answer that to be truthful with it. So I will get with Chief Anderson and we will respond to you and get that to you. And also as far as the funding coming in, again, I'm sorry, we don't have that answer, but we'll get that to you and make sure that we get it to all the journalists that are listening. Thank you.
We'll have our next question from Harriet Wallace.
Yes, good morning, everyone. With recent concerns that we saw at some of our nursing homes, and in light of some of the criticism that we've seen on the state level with what's been called a lack of response or a slow response, what is now the city's plan to proactively protect some of those vulnerable citizens that we have that are still in the nursing homes?
Dr. Caldwell is going to address that question.
Good morning. This issue also came up yesterday. We have a representative at the Emergency Operations Center who is representing all of the nursing homes, assisted living, and elder residences throughout Davidson County. We are working with each of them as a group through the Tennessee Healthcare Association, as well as individually, to make sure that they are meeting the highest standards possible to be able to restrict visitors, to test all of their employees on every shift, and to make sure that these populations who we are most concerned about, because you and I all know somebody there, whether it's a close relative or just a friend. And I'm really concerned about them, and I want you to know that it is the highest priority of me and the mayor to make sure that these nursing homes, these assisted living facilities have everything that they need to protect their residents. I yesterday had a full briefing on the situation that happened with the nursing home in Gallatin, and we're going to do everything that we can to make sure that nothing like that is replicated. But this virus is still something that we're learning about. And the take-home message is that whether you have symptoms or not, you potentially could be infectious, and every one you see could potentially infect you. We have to right now believe that, because if we don't believe that, we're not going to take the safer at home order in a way that we should. So please make sure you do not be a vector, because all of us, no matter how we're feeling now, could be a vector. So we're working with our elderly population, and please know that we need all of us to participate to make this so that we push this virus away from our community. Thank you.
Now we'll have Brett Kelman.
Hi, thanks for taking the question. This is for Ms. Roberson. She mentioned moments ago a rise in domestic violence calls, and I was curious if she could quantify that in any way. If we're talking about a 1% rise or a 10,000% rise or somewhere in the middle.
Yes, our latest statistics show that in the first 2 weeks of March, and I preface that by saying that part of this started during the tornadoes that hit Nashville. But during those first 2 weeks, our domestic calls, our calls to our texts and our hotlines were up 55% from the same time last year, and they have continued to rise. So a 55% spike in the number of calls that we've received is very significant.
Next, we have Kara Hartnett.
Hi, yeah, I was just wondering if we're keeping an eye on the infection rate among essential workers, and if so, are we seeing a disproportionate amount of cases among them?
Thanks, Dr. Caldwell is going to answer that question.
Yes, healthcare workers, our first-line responders, people in the community that are working at grocery stores, those stores that are open. We are concerned about everyone. We are not seeing a particular increase in any of those particular groups except for the healthcare workers, and we do know that those are being very properly identified, and those workers are being removed from the workforce promptly. Out of all the cases that we've reported in Nashville, Davidson County, the majority are still spread throughout the county. So while we are not seeing a particular spike in those essential workers, we are seeing them, and we are most concerned about them. So every time that you choose to say, I need to go out of the house to do something that you need to do, think, do I really need to do that? Because every time you go out, you could potentially yourself expose one of these essential workers. Thank you.
Lastly, we'll have Nancy Amons.
Thank you. I have a question for Dr. Caldwell. What private lab is the city using for the testing? And also, is the city going to get the 5-minute machine from Battelle?
Dr. Jahangir and I and Mayor Cooper have worked with the Tennessee Department of Health to identify a private lab called AEL. The Tennessee Department of Health has provided for payment for that. So that is the company that we are using. We are expecting that all the results will be back within 7 days. Now, for the quick tests, we're really, they were just FDA approved. We're very interested in it. We're going to try to learn as much about it as quickly as we can. And yes, we would love to get those in our community as fast as possible. We just don't have a time frame on it yet. So thank you.
That is all the time that we have for questions this morning. A video recording of this broadcast will be made available later today. Thank you everyone for joining us, and this concludes today's COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.